Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about insomnia. So let's get into it. So as you probably already know, insomnia is a sleep disorder. It's characterized by either having a hard time falling asleep or staying asleep. But there are different types of insomnia, so I wanted to break that down. The first of which is acute versus chronic. Just like many illnesses, we have acute versions and chronic versions, and they are defined by a time frame. So acute insomnia can last for one night, you just have a hard time going to sleep one night, to several weeks. Whereas chronic insomnia, you have to have at least 3 nights a week for 3 or more months. That's when it's considered chronic. There's also primary and secondary causes. So primary is you have insomnia, but it's not related to anything else. Secondary, which a lot of people experience, is related to other health problems. So things like asthma, right? People with asthma, depression, substance abuse, you name it, right? Insomnia can be a symptom that goes along with their primary illness. So that is a secondary cause. Primary is when you have it just by itself, and secondary is when it's related to some other problem you're having. In more specific terms of the different types, because we said it's either trouble falling asleep or staying asleep. So if you're having trouble getting to sleep, falling asleep, that's sleep onset insomnia. If you're having a hard time staying asleep, that's sleep maintenance insomnia. Mixed insomnia is both, right? So you have both a hard time getting to sleep and then staying asleep. And then finally, paradoxal. This is when you underestimate the amount of time you are sleeping. Basically, you do not feel well rested. Maybe you did get 8 hours of sleep, but you wake up and you feel horrible. You just feel exhausted, like, oh, did I sleep like 3 hours? It doesn't feel like I slept 8 hours. That is paradoxal. And I'm sure most people experience a couple of these things, right, at least in the acute form, on a regular basis. That happens, that's normal. But it's not normal to have insomnia, and it's especially not normal to have chronic insomnia. So let's talk a little bit more about it. When it comes to the causes of insomnia, they can be broken down into 2 categories, the primary and the secondary. So if we remember, primary is it's not related to other health conditions, and secondary is it is related to other health conditions. So starting with primary, it can be caused by stress. Maybe you just had a really stressful day, so you're having a hard time falling asleep. The environment in which you're trying to sleep. So maybe it's like really loud, or maybe it's really bright, there's a lot of light going on, or maybe it's really uncomfortable, things like that. Your own genetics. So insomnia does have a tendency to run in families. Changing in your sleep schedule, so maybe you've traveled somewhere, you're in a different time zone, or you've taken a nap throughout the day when you normally don't do that. So changing your sleep schedule. And then you're overstimulated, especially before bedtime. So watching television, being on the computer, playing video games, things like that before bedtime can cause insomnia. Secondary causes, which are related to other illnesses, could be depression and anxiety. Of course, being in pain. It's hard to fall asleep when you're in pain. Having hypothyroidism or some other endocrine issue. Certain medications. This can be a side effect of certain medications. If you have other sleep disorders like sleep apnea or restless leg syndrome, pregnancy, dementia. A lot of times our patients with dementia, especially as they start to get more advanced in their illness, have a harder time sleeping, and they have a weird sleep schedule when they fall asleep and stay asleep, and they don't sleep for very long, so they have a hard time. Those with ADHD, and those experiencing PMS or going through menopause. Some risk factors for developing insomnia. Those chronic illnesses we just talked about, so those causes of secondary insomnia. Being a woman and being over the age of 60. If you have a very stressful job or a stressful life, that's considered a risk factor. And then if you have an irregular schedule, like nurses, a lot of times we have irregular schedules, right? You have your 12-hour shifts, you have your 3 on, you have your 1 off, you have your rotating weekends, sometimes you have to work day shifts, sometimes you have to work night shift. All of that messes with you, right? So you don't have a regular daily schedule. Some symptoms of insomnia, I bet you know most of them. Difficulty falling asleep, waking up in the middle of the night, waking up too early, feeling tired or sleepy throughout the day, being irritable or a little bit grouchy, right? I know when I don't get enough sleep, I'm a little grouchy too. Difficulty focusing or remembering the things you need to do. You have a hard time paying attention to certain things. And then you have an increase of errors at your job or accidents. So these are all signs and symptoms of insomnia. And how is this diagnosed officially? Well, you're going to see your doctor. They're going to do a physical exam. They're going to examine you for these other chronic illnesses that might be part of it. They might ask you to do something called a sleep diary, where you record for about 2 weeks your sleep pattern. Do you wake up at night? How do you feel throughout the day? Do you feel tired? Things like that. They might want to talk to your partner. So if you're married or you have a partner that sleeps in the same bed with you, do they notice you have any like tossing and turning? Do they notice you stop breathing while you're sleeping? Things like that. And then they might want to do a proper sleep test or a sleep study. This is where you actually have to spend the night at a sleep center and they monitor you and they observe your behaviors, they check your vitals, they observe your brain waves and activity, and this is a full sleep test to see what's going on with you before they would officially diagnose you with insomnia. When it comes to the treatment of insomnia, it's broken up into acute and chronic. So acute, that's that temporary insomnia, usually requires no treatment and it goes away on its own. Chronic insomnia, on the other hand, has a harder time going away. It lasts a longer time, so we need treatment for that. And there's a lot of options. You could do cognitive behavioral therapy, so identifying those negative and intrusive thoughts that keep you up at night, controlling the amount of stimulus that you interact with at nighttime, relaxation techniques, especially those who experience a lot of stress in their daily lives, sleep restriction therapy, so this is when you avoid things like taking daytime naps. And when you feel tired or sleepy throughout the day, you push through it and you ignore it, and then when you go to bed, then you'll feel like sleep deprived and you'll fall asleep easier. That's kind of the concept behind that. Light therapy, changing your medication. So if the cause is your medication, if you're having insomnia as a side effect from your medication, maybe they can change the medication, change the dose, anything like that, and that might help. Avoid large meals before bedtime. Treat pain. So if insomnia is related to your pain, you can't fall asleep at night because you're in pain, then we need to treat your pain, right? Nobody should be in pain. So treating your pain is also going to help with your insomnia. And then you can take like over-the-counter supplements, non-prescription medications. Those usually contain antihistamines, which will make you feel very drowsy, but you're not supposed to take them every day. So you're not going to use that to treat chronic insomnia for a long period of time. So if you're doing that already, you need to tell your doctor. Now, prescription sleeping pills, right, you have to get those from a doctor. Those are commonly prescribed to treat chronic insomnia. But one thing I do want to point out, they can become habit-forming. So to the point where you cannot sleep, period, without this medication. You need this medication in your life. So keep an eye on that if you notice a dependence is starting to happen. But prescription sleeping pills is also an option for chronic insomnia. Some complications of insomnia can include increased risk for developing high blood pressure, obesity, depression, anxiety. You have an increased risk of falling, and you have a slower reaction time. So increased risk of having an accident or an error occur because of your slower reaction time. When it comes to prevention, there's a helpful little memory tool for this one. So it's asleep. A is for avoiding, so we're going to avoid alcohol, caffeine, and naps throughout the day. S is for sleep or sex. These are the only things you should be doing in your bed. So no reading before bed, no watching TV before bed, things like that make it harder to fall asleep and can promote insomnia. So to prevent it, the only things you should be doing in your bed. Lights off, so a dark environment. Exercise. Exercise is good for our body. We encourage exercise, but don't exercise right before bed. E is for early rising, so you want to keep that sleep schedule. If you get up at a certain time Monday through Friday for work, you should get up at that same time on Saturday, Sunday too. So don't sleep in on the weekends. E is also for evaluate your meds. So is insomnia a side effect of your medications? Looking into that, looking at the meds you're taking and seeing if insomnia is a side effect of them. And then finally, P, make a plan for bedtime. So keep a sleep schedule and stick to it. So that was my video on insomnia. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.